people just don't have the resources to actually monitor, so they sort of do the easy thing up front and just blanket ban things. I can recall in Ontario there was a case where somebody lost a laptop at sick kids, and there was health information on it. The privacy commissioner did a blanket ban and said all mobile devices and everything that was not chained to a desk had to have full disk encryption. So obviously devices like BlackBerries, iPhones, and all these fell under that, but a lot of them don't have those capabilities. And we see these policies all over where it's just a blanket ban to cover everything because the easiest thing to do. So are these?
You also raise another point too, is that again our systems could be a lot more secure, but some of the costs involved in making them more secure are significant, let alone the impact on day-to-day operation.
I mean, do other countries have these levels of?
No, well, that's a good question to ask the Danish fellow. Okay, and it's not when I study other countries, it's not an aspect that I tend to spend a lot of time on. But there's a lot of cultures where, I mean, like a lot of the Swedish countries, not all four of them, I meant Scandinavian countries, they have a unique identifier for health. It's also the same unique identifier they use for their driver's license, for their income tax records, for everything. That's just the way they run their society. We've had that since the 40s. And the issue around privacy and security and confidentiality doesn't seem to be as pervasive as it is in England, as it is in Germany, as it is in Canada and the United States. Some sectors of society, it's not nearly the same. Doesn't mean it's not there, it doesn't mean they don't address it. Doesn't mean they don't address it. Like the Spaniards, to give you an example. I mean, they built a lot of security into their system because they decided they wanted to protect privacy by giving everyone a card, and that was the only way into the system. The Austrians, once they get their systems up and running, will have the same kind of thing. Because again, the physician doesn't get access to anything without the patient giving them a card, their card. So, Mr. Johnson, you have your hand?
Yeah, just 2 comments. First, in regards to auditing. So now in my facility,
Speak up, please. Speak up, please.
Sure. Whenever a celebrity patient comes, so we perform auditing to see whether there are nosy staff, and people were fired.
They were.
Yeah.
Because there are other stories where access to records occurred and nothing was really done.
Yeah.
We've lost 2 employees to inappropriate access.
I mean, I've always contended that this whole thing, security and privacy, could be easily minimized by someone randomly checking on a regular basis all accesses and looking for the role relationships and just randomly every once in a while, and if when not once in a while, randomly, regularly checking. And you can build algorithms to help someone do that kind of job, and then do something about it. And it won't take very long for the message to get out. But in a lot of cases, nothing's done about it because there's a shortage of that kind of staff. And if they lose that person, then they have to go find another one, and there's a shortage.
I think there's just a bit of a double standard as well, because all of a sudden with electronic health records, everyone's so obsessed about privacy, and with paper-based records, the file is sitting there on the countertop, and anyone passing by, I've worked in institutions where they have paper-based records, and the janitor can look in the chart, or whose chart is this? It's sitting on the counter. They'd open it and look at it, right? And so I think there's a bit of a double standard as well.
There's that element. Yeah.
I had another second comment in regards to patient identification.
Yeah.
And the problem with what number to attach to the person. So now there are some countries, such as in Israel, where they starting to establish a bio database. That means that it's a fingerprint identification.
A bio database.
Yeah. And that will be incorporated to medical use as well. So that may be
Nationally?
Yeah.
To make sure I got it.
So any of you use any kind of technology where you have to put in your fingerprint or an eye scan or not to access?
Yeah, the Jewish General Hospital in Montreal, did part of my training there. You log into the hospital radiology system and lab system using your
Thumbprint. Okay. Yep. Robin?
What? I remember Shirley was doing what is the status of the unique patient identifier across the country? Do you know
Well,
what the status is in DC right now?
Well, yeah, I believe generally in most of our Canadian provinces, at a provincial level, we have a unique identifier.
Which is the PHN number.
Which is the PHN.
But most hospitals don't use the PHN.
That's a different question, right?
Because we've had a horrible,
Yeah, that's a different question.
it's unbelievable what is going on through some of the health records. In Children's Hospital, we have had incidences where an infant is in ICU and has 3 different numbers.
3 different PHNs or 3 different numbers?
3 different numbers, hospital numbers.
Oh, okay.
They get admitted as baby so-and-so,
Admission number,
they
that's
assign
right.
them a number.
A medical
It's not
record number.
rectified, the patient then has a different number signed under a different name, the other surname,
Yeah,
and it's an incredible
Yeah.
mess. And I can't believe it's such a big
yeah,
deal, and it's horrible. It's a patient safety issue.
yeah, and infant children is a separate little issue in itself, just how do you deal with that reliably? Because provincially, to use the PHN, you have to, particularly if you don't have it in your system, in your local system, you have to access the provincial system to get the PHN. And I'm not sure whether the San Joaquin BC hospitals still have access to the client registry online. Anyone know? I'm pretty sure they don't all. I'm not sure the bigger ones
And you don't register.
have online registries. Okay, anything else, folks? Long first day of a heavy 2 weeks. This will be a point in time of your lives for those of you the first time. You'll look back and say, wow, 2 weeks ago. I hope you got something out of our 2 sessions this morning. I was glad that Roger reinforced that what we've accomplished to a large extent across this country can be attributed to InfoWay. And InfoWay has managed to obtain a degree of federal, provincial government cooperation that is almost unique. It probably doesn't exist in any other sector of healthcare where the federal government and the provincial governments agree on something together. The state of play for those bodies is constant fighting between the federal government and the provincial government. It's always the provincial government against the federal government. Every once in a while, we get the Ontario government complaining about Newfoundland, or not an Alberta government complaining with the Newfoundland government because they want to start seeing some money back that they've been giving Newfoundland for years. Because they've been a half province and Newfoundland is now a half province. Alberta's arguing they want some money back from Newfoundland. Anyways, but InfoWay has been able to get a degree of cooperation that is unique. It just doesn't happen in home care, it doesn't happen with drugs, it doesn't happen in long-term care. There's no other policy agenda where the governments agree and work together cooperatively. This particular one they seem to. And Manitoba, yeah.
So it's just related to that, sort of the synergies between InfoWay and the provinces such as Manitoba.
Yeah.
Roger kind of left an impression with me that they weren't moving forward with any projects unless there was employee funding, but I
No,
would,
it's
yeah,
not.
okay, because I wouldn't see that you would need to have InfoWay approval and funding before embarking on something you need.
Well, InfoWay has the money, okay, and the provinces like to take advantage of the money. And if you don't sort of tap InfoWay's money based on their rules, then of course you're on your own. And with the current economic climate, most of the provinces will work on sort of InfoWay approved projects. Got to remember too, when we say InfoWay, and the Auditor General's report that came out, I don't know if you read it, didn't, in my opinion, give enough credibility to the reality that InfoWay is controlled by the provinces. They control InfoWay, okay? They are the owners of the company. Infoway is a company, nonprofit company. It's owned by the provinces, every province. The board of directors, at least half the board members, are representatives from the provinces. Okay? So we sort of we can sometimes be critical of Infoway, not realizing that really we should be perhaps critical of the provinces. Infoway cannot tell anyone to do anything. All we can say is, we will give you this money under these conditions as long as you do the following. But we cannot force any government to do anything. They don't have that mandate. So what we've been able to accomplish across the country, and the other thing that it was it was Dick, who said, you heard him say, that he'd like to see the project's chart of how things are going to reflect the reality. So he says 9 out of 10 of them should be red, which means they're in trouble. They're behind, they're either over budget or behind, usually behind. But then the provinces, who he has to respond, say, no, we can't do that. We can't show them as red, because it'll be too politically embarrassing. So a lot of the challenges we have to make things happen in Canada are sometimes held back because they might be politically embarrassing.
Dennis,
And healthcare is a very political system. Yeah.
so if their strategic funding, plan is to hold back 50% until there's some benefits realization of adoption and uptake, how does that play into this? So are they, so there's...
Messy. It's messy. It's messy. Okay? I mean, you have to really study the benefits realization framework that they use and the degree in which they really implement it. Okay? So it's messy. I mean, they're in a very unique situation. They're in effect saying to their bosses, sorry, we're not going to give you the money, but yet you're my boss. It's that kind of situation. So it gets very messy at times. But generally, we're making progress that we're better off than we were 10 years ago. We're better off before Infoway was created.
Something to ask a question. There seems to be some initiatives where, I'm not sure exactly the mechanism, but one province will accept a leadership role.
Correct, that's correct.
And like Panorama, the public health surveillance, like was a classic
BC.
example of that.
BC's BC's
So do you see that, is that a trend that's increasing over time?
Oh yeah, it's been going on for a while, and I suspect it will continue. If we can keep Infoway together, and the only way we can keep Infoway together is if the federal government keeps pouring new money into it. I mean, Infoway was in some great uncertainty in the last 6 to 9 months because of the fiasco what happened in Ontario, and the federal government is holding back the money. If Infoway doesn't have any money, they don't really have a job. So therefore, we lose that unifying organization to keep the country together. So we need them to continue to be getting inserted with new funds to keep moving the agenda forward. Okay. And that approach of saying, okay, we want to move the public health thing. We agree, provinces get together and try to agree that this is what we're going to do. And then one of the provinces gets assigned a lead. Right? The client registry lead, I think, was Saskatchewan. They led the efforts on the client registry, which is the registry which keeps track of all the people in the province. And now the provinces picked up, once they got that going, they picked it up. I think Alberta was the lead on the provider registry, the registry which keeps track of all the providers, which is not nearly as well developed yet across the country. And I think Saskatchewan also, was it Saskatchewan? I'm not sure anyone's picked up the lead on the location registry yet, which is the other piece that's missing, which is if we're going to have interchange and interoperable records and exchange data, we have to know where to send the data from one point to the other. So basically the location registry will keep track of where everything is, like where all the hospitals are, where all the labs are, and so on.
Because I was a little confused about his response to Robin's question, because you asked a question about the viewer.
Sorry, David, if you were here.
You asked the question about the viewer, and the answer that I heard was that there's very little leverage in certain components based on the starting point of each of the provinces. That in this other form, this other approach, there seems to be much greater
Well,
ability to never.
it's
never-
where this approach is working